Welcome, everyone. When you're looking out for your health, or maybe the health of someone you care for, especially as they get older, well, staying informed is just crucial, isn't it?
Absolutely.
And sometimes that means getting your head around certain medical tests. Today, we're going to do a deep dive into one of those, the arterial blood gas test. You often hear it called ABG.
Exactly. And look, for many people, maybe you're navigating your own healthcare as a senior or perhaps supporting an older parent or relative. All the medical terms can feel a bit overwhelming.
Mm-hmm.
So our goal today is really to simplify this ABG test. What is it? Why might a doctor order one? And, what can the results actually tell you? We're using reliable info here from places like Medline Plus and HealthWise.
Great. Okay, so let's get right to it then. What is an arterial blood gas test? It sounds pretty technical.
Yeah, it does sound a bit complex, but in simple terms, an ABG test measures the levels of oxygen and carbon dioxide in your blood.
Okay. Oxygen in, carbon dioxide out.
Right. But it also checks the acidity of your blood. That's what doctors call the pH balance.
So it's looking at the gases and the overall balance, like if things are too acidic or not. Now, why specifically arterial blood? Most blood tests I've had are from a vein in my arm.
That's a really good question. It comes down to what the blood is carrying. Arteries, you see, are the vessels carrying oxygen-rich blood from your lungs out to the rest of your body.
Ah, okay.
So because of that, arterial blood is the best place to measure how well your lungs are actually doing that job, getting oxygen into the system.
Whereas veins are bringing the used blood back.
Exactly. Veins carry blood back towards the lungs after the body's tissues have used up the oxygen and added carbon dioxide as waste. So the levels would be quite different.
I see. So using an artery gives like a direct reading on how well the lungs are fueling the body and clearing out the waste gas?
Precisely. It's a good analogy to think of your lungs as, say, an engine. The ABG test is like checking how efficiently that engine is taking in fuel, the oxygen, and getting rid of the carbon dioxide.
That makes sense.
And you might hear other names for it too, like blood gas analysis, arterial gas analysis, sometimes even oxygen saturation test, though that's really only part of what it measures.
Okay, got it. So we understand what it measures. Now, thinking about our listeners, particularly seniors or those caring for them, why is this test so relevant? What sort of health issues might lead a doctor to order an ABG?
Right, this is key. As we get older, things like maintaining good breathing and just general balance in the body become even more critical. The ABG test gives really valuable insights into common concerns for older adults.
Like lung problems.
Yes, definitely breathing issues linked to conditions like COPD or asthma. But interestingly, it can also shed light on kidney issues.
Oh, kidneys too. How do they fit in?
Well, both your lungs and your kidneys are major players in keeping that delicate acid-base balance, the pH level in your blood, right where it needs to be.
So if lung function or kidney function isn't quite right, this test could flag that.
Exactly. The ABG shows doctors how well the lungs are handling oxygen and carbon dioxide. But it also gives clues about how well the kidneys are helping manage that blood pH. So it's super helpful for diagnosing and monitoring problems with these organs or other conditions that throw off that acid-base balance.
Okay. Can you give us some specific examples? Like, what symptoms might make a doctor think, oh, we need an ABG here, especially for an older person?
Sure. Let's say an older adult suddenly starts breathing really fast or deep, and they can't control it. Or maybe they're feeling nauseous, vomiting, have an irregular heartbeat, perhaps new confusion or unusual tiredness.
Things that might seem a bit vague sometimes.
They can be.
Huh.
Even muscle twitches or cramps could be related. In those cases, an ABG can help figure out if there's an underlying imbalance causing those symptoms.
Okay.
And it's also very commonly used for seniors who are already managing known lung conditions, asthma, COPD, cystic fibrosis, even myasthenia gravis. The test helps doctors track how well their treatment is working.
Right, for ongoing management. What about more sudden events?
Oh, absolutely crucial then. Think about situations like suspected carbon monoxide poisoning, or maybe after smoke inhalation from a fire.
Yeah.
An ABG can quickly show how much oxygen the blood is carrying or not carrying, and if carbon dioxide is building up dangerously. It's also used a lot in hospitals when someone is on oxygen therapy.
To check they're getting the right amount.
Exactly. Make sure the settings are right. And going back to that balance idea, doctors might order an ABG to check acid-base levels in older adults who have heart failure, kidney failure, maybe uncontrolled diabetes, or even some sleep disorders.
So quite a wide range of situations. Knowing when it might be used is helpful. Now, let's say the doctor orders one. What's the actual experience like? You said it's different from a normal blood draw.
Yes, it is a bit different. As we mentioned, it uses arterial blood, not venous blood. And for adults, the most common place to take the sample is from an artery in the wrist. The radial artery, usually.
The wrist, okay. So what's the process? Walk us through it.
Well, first, the nurse or technician will probably check the circulation in your hand. There's a simple test called the Allen test they might do. It just makes sure there's good blood flow from the other main artery in your wrist, just as a precaution.
Makes sense.
Then they'll clean the skin over the artery, usually on the inside of your wrist, and then they insert a small needle to draw the blood sample.
Is it more painful than a regular blood test?
It can be, yes. Arteries are a bit deeper than veins, and they have more nerve endings around them, so it might feel a little more uncomfortable, maybe a sharper sting. But they can use a local anesthetic, a numbing cream or injection beforehand if needed. Just ask about it.
Okay, that's good to know. What happens right after they get the blood?
Immediately after the needle comes out, they'll apply firm pressure to the spot, and they'll hold it for quite a bit longer than with a vein draw, maybe 5 or even 10 minutes.
Why so long?
Because the pressure inside arteries is higher than in veins, so there's more potential for bleeding or bruising. Holding pressure is really important to prevent that. Once they're sure the bleeding is stopped, they'll put on a bandage.
Got it. Pressure is key. You mentioned newborns earlier. Is it different for them?
Yes, for babies, the sample might be taken from a small heel prick or sometimes from the umbilical cord right after birth.
Okay. Now, preparation. Is there anything specific someone needs to do before having an ABG test?
Yes, a few important things. First, if you take any blood-thinning medication that includes things like warfarin, heparin, newer ones, but also even just aspirin.
Oh, even aspirin?
Yes, even aspirin. It's really crucial to tell your doctor about all of them beforehand. They might advise you to pause taking them for a short time before the test because they can increase bleeding risk.
Right. Anything else?
Definitely tell the healthcare provider doing the test about all medications you're taking, including vitamins and supplements. Just give them the full picture.
Okay. What about things like oxygen therapy or smoking?
Good points. If you're currently on oxygen therapy, sometimes the doctor wants to see what your levels are like breathing just room air. If it's safe for you, they might turn off the oxygen for about 20 minutes before the test.
But only if it's safe.
Absolutely, only if it's safe. If you need continuous oxygen, they won't turn it off. And smoking, yeah, definitely avoid smoking right before the test. Secondhand smoke exposure, too, if possible. Smoking directly impacts your blood oxygen and carbon dioxide levels, so it could skew the results.
Okay, that all makes sense. So we've covered the what, why, how, and prep. Let's get to the results, the nitty-gritty. What are the main things measured in an ABG, and what do they actually tell us?
Right, the results give a lot of detail. One key measure is oxygen saturation, often written as O2-sat or SaO2. This is basically the percentage of your red blood cells that are loaded up with oxygen.
Like how full the oxygen delivery trucks are.
Kind of, yeah. Then there's partial pressure of oxygen, or PO2. This measures the actual pressure of the oxygen gas dissolved in your blood. It tells us how effectively oxygen is moving from your lungs into your bloodstream.
So O2-sat is how much oxygen is being carried, and PO2 is how well it's getting into the blood in the first place.
You got it. Good saturation's great, but if the PO2 is low, it might mean there's a problem with that transfer process. This can really impact energy levels and organ function, something quite relevant for older adults.
Okay, what else?
Next up is partial pressure of carbon dioxide, PO2. This measures the carbon dioxide dissolved in your arterial blood. It's a key indicator of how well your lungs are getting rid of this waste gas.
So high PaCO2 might mean the lungs aren't clearing it out effectively.
Correct. Then there's the pH. This is super important. It measures the acidity or alkalinity of your blood. A very narrow range is normal. Too low means the blood is too acidic, that's called acidosis. Too high means it's too basic, or alkaline, that's alkalosis. Keeping that pH stable is vital.
And I think you mentioned bicarbonate earlier.
Yes. Bicarbonate, or HCO3. Think of this as your blood's natural buffer, like an antacid. It helps neutralize acids and keep that pH steady. The ABG measures bicarbonate levels, which gives clues about how the kidneys are helping manage that balance, as kidneys are key regulators of bicarbonate.
Interesting how the kidneys and lungs work together there.
They really do. The test might also report oxygen content, O2-CT, which is just the total volume of oxygen in the blood sample.
Wow. Okay, that's a lot of information from one sample. How do you know what's normal for all these numbers?
That's a really important point. The normal ranges can actually vary a bit depending on the laboratory and the equipment they use.
Oh,
So when you get the report, it should always list the lab's specific reference range next to your result. But, and this is critical, those ranges are just general guidelines.
right.
Your doctor's the one who needs to interpret your results based on your specific health situation, your age, any conditions you have.
Yeah.
A number outside the normal range doesn't automatically mean disaster. It might be normal for you, or it might point to something that needs looking into.
So don't panic if a number looks off. Talk to the doctor first.
Absolutely. An abnormal result could indicate an issue with the lungs, maybe the kidneys, or even your metabolism, how your body uses energy. Some medications can affect these levels too. It really needs context.
That's really important advice. Context is everything. Are there any other key things for seniors and caregivers to keep in mind about ABGs?
Yes, definitely remember that an ABG test usually isn't a diagnosis all by itself. If the results are outside the expected range for you, your doctor will likely need to do more investigations, maybe other tests, to figure out the underlying cause.
Okay. And earlier you mentioned something called pulse oximetry. How does that compare?
Right, pulse oximetry. That's the little clip they often put on your finger, isn't it?
Yeah, usually the finger.
It measures oxygen saturation, the O2 sat we talked about, by shining light through your fingertip. It's completely non-invasive, quick, and easy. Very useful for monitoring oxygen levels.
So why do the ABG then, if that's easier?
Because pulse oximetry only gives you oxygen saturation. It tells you nothing about your carbon dioxide levels, PaceO2, or your blood's pH balance, or bicarbonate. So if the doctor only needs a rough idea of oxygen levels, pulse oximetry might be enough. But if they need that full, detailed picture of your respiratory function and your body's acid base, balance the oxygen, the carbon dioxide, and the pH, then the ABG is the much more comprehensive tool.
Got it. So the ABG gives the whole story.
It gives a much fuller story, yes. And really, the most crucial takeaway for everyone listening is to always discuss your results thoroughly with your doctor or healthcare provider. They're the only ones who can really explain what your numbers mean in your context and what the next step should be, if any.
This has been so helpful, honestly. Makes the ABG test seem much less intimidating. So just to quickly recap for everyone, especially if you're older or caring for someone who is, this test, the ABG, is a really valuable tool. It gives a detailed snapshot of how well the lungs are working.
Getting oxygen in, carbon dioxide out.
And also checks the overall acid-base balance in the body, which involves the kidneys too.
Exactly. It helps doctors understand lung and kidney function better, and it's key for diagnosing and managing a whole range of health issues.
But as you stressed, while understanding the basics is great, always, always rely on your healthcare professional for the interpretation and advice specific to you.
Couldn't agree more. They piece together the whole puzzle using the test results alongside everything else they know about your health.
So perhaps a final thought for our listeners to ponder. How might having this better grasp of what things like oxygen levels, CO2, and pH actually mean empower you or your loved one to have clearer, more informed conversations with your doctors? Maybe feel a bit more confident asking questions.
That's a great question. Knowledge really can be empowering in healthcare.
And maybe explore some of the conditions we touched on, COPD, kidney issues, using those trusted sources like Medline Plus and HealthWise. Thanks for joining us for this deep dive.